due by May the 6th. You need to have ULOs out and review your well points. A couple things at stake. We're going to have obviously your premium reductions, which may be more than important than ever this year, and a day off. So please get those in so we can get that all turned in and calculated. And our speaker today is Division Chief Gabe Hanna, and he's been with us since 1995. And he was an EMT when he was hired, and has been promoted through the ranks. He's obtained paramedic certification August 2014, and promoted to captain in 2014, and been division chief. He's a '93 graduate of UT Knoxville with a BS in wildlife science and a minor in forestry, and we greatly appreciate him coming and helping us all out on this topic. So I'll let you go ahead.
All right, guys, thank you for coming here today and letting me take up your lunchtime. When they asked me to do this, I kind of looked at the topic and thought, this will be right up my alley, being a paramedic and being this is what we do for every day while we're here. So we can do this one of two ways. I can cover some things that I feel are the most important things, and we can do some questions and make sure everybody's on the same page. And if that's okay, that's the way I'd like to do it. So of the things they wanted to talk about was some basic first aid. So the first thing is, to me, is heart attack, is your cardiac. So when we look around the city, we see a lot of places now that have AEDs installed. You can get an app on your phone, and it'll give you locations of AEDs around some cities. I don't know if that's implemented here in Hendersonville, but you can do that a lot now. You can find apps that'll have the AED locations in your city. So if you work in City Hall, where's your AED here? It's down the hallway. Does anybody know if it's hooked up? Then when you open the door that it sends the signal? It is hooked up? Okay. So the top AED you guys have, and I spoke to Chuck yesterday, you guys took a refresher AED back in September, October, is that correct?
I was like a month ago, right before Chuck left. So
oh, great.
A month and a half ago.
So you guys are good with that. So looking at your AED, you guys have a fully automated AED, which means you don't have to push a button to get it to defibrillate, correct? Okay. So when you open up that AED, does it prompt you to do what you need to do next with voice commands? It does. So where do you put the pads? All right, so what we're going to have next is we're going to have a choking session because I'm going to ask you questions while you're trying to eat. So, all right, so you've got two pads, right collarbone, left armpit. If you look on the pads, it gives you an indication of which pad to put where. One of the biggest questions that will always arise is, what if I put the pads backwards? It's okay. You can still use it. The main thing that you don't want to do is overlap the pads or let them touch. That causes an issue. The only time that would play an issue is when you use it on a child, and then you do front and back. So as we go through the AED use, do you guys, or would you, on your AED use, when do you call 911? If it's not mounted in a box, when you open the box automatically, when would you call 911? Immediately. Go ahead and get us started your direction. You want to get us started in that direction, get EMS started, so that way any delay is minimal and we get on scene quickly and able to take over and get things taken care of. So one of the most important things about AED is early recognition, early defibrillation, and quick access to definitive care, getting into a cath lab and getting that taken care of. So one of the other things I want to talk about was stroke. What are the signs of a stroke?
Sign of weakness.
All right. Speech. Any of those things are typical stroke indicators. So again,
Engine 3, I need you to run out of CMS. One, correction, I need you for a lift assist, 137 Vintage Circle, 137 Vintage Circle. It's going to be for assistance with lifting a male.
Okay, so strokes. We talked about some of the symptoms. What's key in stroke? When you recognize somebody's having a stroke, what is key there? It's time to definitive care. You've got a couple of hours to get that person to definitive care to be able to, for the doctors to be able to give the clotting, the anti-clotting medication to get them, try to restore blood flow to that part of the brain. So quick care is essential. So let's talk about anaphylaxis. So what is anaphylaxis? It's a severe allergic reaction to, what are the two most common things people have allergic reactions to? Bee stings. What food is one of the most common ones? Peanuts. So when you have anaphylaxis, there's a little bit of difference between anaphylaxis and hypersensitivity. Hypersensitivity, somebody may get stung by a bee or have a mild reaction to it, local swelling. They may get some hives around their stomach or on their axillary parts of the body. They may have a little bit of itching in the area, but that's okay. Hypersensitivity is not a bad thing. A lot of people will have that. The issue becomes when you have a problem with the airway. So remember, if they start having a lot of swelling on the outside, remember, all that swelling you see on the outside is also occurring on the inside. So think about that for just a second. Your body starts to dump fluid because of the venom. It doesn't want that venom in its system, so your body dumps that fluid out. It creates hives. So every hive you see on the outside is also occurring on the inside. And if that occurs in the airway, it becomes a very serious problem very quickly. You'll start seeing wheezing. You'll start seeing them get into a tripod position where they'll put their hands on their knees and try to open their airway up, try to take the weight off their shoulders so they can breathe easier and quicker. There's only one fix for that, and that's an EpiPen or an Epi injection. A lot of people that are sensitive or have allergic reaction or allergic history with bees will carry an EpiPen with them. If they can self-administer, if you can help them administer that, absolutely administer it, because that's the only thing that's going to help that airway in quick fashion. For children, this has been on the news for a long period of time now. You can see that schools are eliminating peanuts from kids bringing those in, or peanut butter and jelly bringing those in, or separating the kids. For kids, it's very, very quickly and very, very serious for them if they have a reaction to these peanuts and can close their airway quickly. You're talking about an airway that's smaller than the size of a pin, so any swelling on their airway is quick to occlude their airway and cause a life-threatening issue. So some of the other things they want to talk about, and if you have any questions, please feel free to raise your hand because I'm going through these pretty quick.
Why do you,
Absolutely.
where do you put the, where do you inject a person with the EpiPen?
On the side of the thigh. Large muscle group right there. Most people that carry an EpiPen, say most, everybody that carries an EpiPen will be schooled in how to self-administer it because they're carrying it for a purpose. Because they know that is that's their lifeline. If they get stung, that's their lifeline. And they'll quickly, you can do it right through their pants, they'll take it and they'll just jab it, and it works quickly. And it's very effective and works very well for them, and that's the only thing that's going to help them.
So it can go through clothes, just a real quick.
You wouldn't want to do it through like insulated pants or a lot of clothes, but right through a pair of jeans or shorts would be fine. Yes, sir.
Do people with EpiPens wear the necklace?
They may or may not. There's no law that says they have to. But a lot of times it's if they carry that pin or you see them wearing that pin, they may wear a medic alert bracelet, which is fantastic if they do, but that's not always the case. I've actually had a reaction. I had to go to the ER. It's been 30 years ago. I had one bad reaction, had to go to the ER, get Epi. I've never had another reaction since then. So I don't know why that one case was any different than any other time I've been stung since. Sometimes you can get stung several times over the course of your lifetime, then that fifth time, that sixth time you'll have a reaction. It's just the way the body works.
Well, what if you don't have an EpiPen and you've never had an incident? How long do you have to get to the ER?
that's going to be based on how quickly that anaphylaxis sets in. It usually sets in pretty quickly. In just a few minutes, you'll just start noticing a lot of swelling around your throat. You'll start noticing swelling in your peripheral, and the issue becomes is when that airway starts to swell, you're behind the 8 ball already. You're already behind the clock. So you got to activate 911 and get somebody there to take care of it and let them know what the issue is so they're prepared to do that when they get there. All right, so any other questions on those two things or those three things? And we'll keep right on going.
In those instances, you are best calling 911 if people trying to take a patient to the hospital.
Absolutely.
What about Benadryl or antihistamine? Does that help?
Those are usually for hives,
Okay.
but that's not going to fix the airway issue. That's for itching and hives, and that's not going to fix the airway issue. Epi's what's going to fix their airway issue.
So the engines and the ambulances have any of that.
Absolutely.
Whereas your driver, you don't have.
Correct. And we can get that to you and get that in you very quickly once on scene, once they do a quick patient assessment. So let's talk about bleeding. One thing that, oh yes, sir.
Is there any problem giving somebody using EpiPen with not having that particular kind of shot?
No. If you think, if the case was, the question was, is there an issue with giving somebody epi that you think may or may not be having an anaphylactic reaction to a bee sting or a food allergy? If you think they're having it, the only thing that's going to happen if you give them epi is you're going to speed up their heart rate a little bit. You're going to make them a little bit anxious. But in lieu of them having an anaphylactic reaction and not giving it to them, it'd be better to give it to them. Anything else? All right, so bleeding. Lots of things have changed over the course of the last few years on bleeding. They used to teach pressure points and direct pressure, elevation, pressure points, and then tourniquet being the last line of defense for significant bleeding. In the fire service and EMS now, thanks to the Gulf Wars and everything that's going on in Afghanistan, they've realized that tourniquets are quickly taking hold of being the cure for massive blood loss. So now I'm not recommending that if you cut your finger or do anything like that, but if you cut something serious, if you witness somebody have an amputation, a hand amputation, foot amputation, which with mowing season coming on has already happened once in Wilson County this year. So to fashion a tourniquet to stop that blood loss is going to be the quickest way to help them in that emergency. So 40% blood loss is pretty much irreversible. If you lost 40% of your blood and you had a transfusion right there, right then, you're on the edge. They may or may not be able to save you with that. So quickly getting something on that, especially if it's something that's a arterial bleed, is important to get that covered. So if you've got something small, like a small laceration to your hand, obviously direct pressure with some gauze is good. If it soaks through that gauze, don't take that off. Just apply more to it with more direct pressure. If you can wrap it with something, that's fine. Keep it wrapped up. Get to the ER as quick as you can. If you need to call 911, by all means, call 911. Let them know what you've done, what's going on, and if you have any other issues that you need to be treated for. But in our case, we all carry these now at the fire department on all the engines. We have these type of tourniquets, so we can apply them if need be in the case of any type of massive trauma or an amputation. What else you guys want to talk about? So we talked about, they also want to talk about sprains and strains. This is not something that I'm a professional on sprains and strains, although everybody can sprain an ankle and strain their back. Biggest thing with that is, what did they teach you growing up is the most important thing for a sprain or a strain on your ankle, or ice, what's the mnemonic that everybody uses? Rice. Rest, ice, compression, elevation. That's the simplest thing you can do for an ankle, knee, anything like that, and that'll pretty much stay off of it. Take some ibuprofen, some anti-inflammatory, and that'll alleviate most of it. If you start seeing a lot of blue weird coloring around the injury area, then, absolutely go see a doctor, go get it checked out, because you can tear some ligaments or damage the muscle, and there's nothing wrong with going in and getting it checked out.
How do you know the difference between a break or a fracture and a sprain or?
Okay, so let's talk about fractures. There's two ways to tell the difference between a fracture and a sprain. Obviously, if you've got a long bone that's angulated in the middle where it's not supposed to be angulated, would mean there's an angle here or there's an angle in your tib fib. Obviously, that would be one way you would tell it's broken. Another way you would be able to tell is if somebody grabs a hold of it or puts a little pressure on it, you can hear the crepitus in the bones. That's not a very pleasant way to find out, because that's going to create a lot of pain. So a couple of things: if you have an angulated fracture, obviously call 911. Don't try to move the person, because remember, those bone ends are very sharp, and any movement within that limb with those bone ends can damage vessels or nerves. So damaging a nerve or a vessel is very serious. You can cause some bleeding within that cavity, and that's the last thing you want to do, is create any more injury by trying to help them. If the bone does happen to come through the skin, don't try to get it to go. Don't move it where it goes back in, because you're looking at that bone has come out. It's come from an environment where it's sterile. Now you've placed it out here where it's picked up dirt or any other bacteria. When you pull it back inside that cavity, it can create some infection in that area, and that's the last thing you want to do. All right, insect bites, bug bites, snake bites. There are poisonous snakes, venomous snakes in Tennessee. There's cottonmouth, copperhead, and 2 types of rattlesnakes. Now, are they in Hendersonville? Last year, there was a report of one being caught down on Indian Lake. One of the animal removal companies actually removed one from somebody's by their house or out of a field. So typically, do you see them in town or around houses? Typically not, but especially you guys that are out cleaning up around your house this time of year, you are possibly going to come up on one, so just be very careful. Learn how to identify them, learn about how their characteristics are, what they look like, venomous versus non-venomous snakes. But if you get bit, don't hesitate to go to the hospital or call 911 and get transported to the ER, because you don't want to take a chance. The venom in those snakes are very, very unfriendly to the tissue, so you definitely want to get that checked out and go to the hospital. And if you can ID it, and you can get a picture of it, don't try to reach down and grab it after it bites you the first time, because maybe the first time it didn't inject much venom, you reach down to grab it again and it hits you the second time, and it may light you up that time and inject some venom. So get away from it after the first strike, and if you don't know what kind of snake it is, get to the ER and get it checked out. This time of year, we always come across heat stroke and heat exhaustion. You get a lot of people that are out in their yard overworked this time of year, because they want to get out, they want to get their yards cleaned up. They're not acclimated to the warm temperatures. We didn't really have much of a spring. It's warmed up pretty quick. So what you'll see people come outside, they're still acclimated to cooler temperatures. They're not really acclimated to the heat yet. So they get out, they overwork themselves, they'll start sweating profusely. And when you get into heat exhaustion, you might get a little nauseous, you'll get a high heart rate, you get a little bit dehydrated. That's when you know you need to rest, you need to get inside, you need to cool off, you need to drink plenty of fluids. If you push past that and get into heat stroke, you're going to notice you get very nauseous, probably going to throw up, you're going to get dizzy, lightheaded, and the key thing is that you're going to stop sweating. If you get to the point where you stop sweating, you've overworked your body's cooling mechanism. Your body can't cool itself. Your core temperature keeps rising, and you're going to harm yourself. And potentially, if it's not treated and recognized, it could be fatal. So be cautious when you're working. Don't overwork yourself. Don't overexert yourself. Stay hydrated, and definitely don't get overheated. So burns. So in looking at burns, there's several different classes of burns. Sunburn is a first degree burn. It's only on the surface. It's damaged the surface of the skin. And one thing that you're going to notice if you get sunburned during the day, what happens at night when you go back to the house and you go inside where it's cool? You get cold because your skin is the largest organ in your body, and it's the temperature regulation of your body. So if you burn it, it really messes you up at night. You're going to get cold, and it's painful as well. So second, third degree burns, that's where you start getting serious tissue damage. You're going to notice blisters. You're going to notice some skin damage. Second, third degree burns, I would definitely recommend you go to the ER. Even first degree burn, if it's over a large enough surface area, I would definitely recommend you go to the ER and get that checked out. Burns are nothing to be joking with, because especially they're very harmful to the body, especially if you get burns on your hands, feet, or your face. Because the way the medical industry looks at that, your hands and your feet are your functional parts of your body, and if those are damaged seriously, then you may lose function of your hands or your feet. And if you have burns around your mouth or your face, that can occlude your airway or possibly an airway issue, so they want you to come in for those as well. Because in burns, one of the key things with burns around your mouth, your nose, your face is the airway gets overheated and it can burn and swell. Again, it occludes the airway, and it happens pretty quickly. So in the event that you do get burned and it is serious, please go to the ER and get that checked out. And don't hesitate to call 911 either. So, are any questions, anything you guys want to ask specifically and talk about?
Are there any, like, poisonous insects that would require medical attention, like, in this area?
Okay, so like brown recluse.
Yeah. Okay.
Yes. And yes, what you see on the internet from brown recluse are the worst of the worst. Their bite is not very painful. Typically, you don't feel it. But their venom is necrotic, which means it rots tissue away. Some people respond to that worse than others. It's just like being stung by a bee. Some people respond to it very poorly. Some people respond to it very well. They don't swell up much. They don't have much of a reaction. But with spider bites, especially brown recluse, is to note when you notice that redness, when you notice that area that's been bitten, and then watch it over time. And then if it does begin to exhibit signs of what you're looking for that white circle in the middle with a red area around it. If you can watch it and mark the edges of it, and if it starts to grow and get big, then yeah, you definitely need to go see a doctor. Not going to say it's an ER visit, but you can definitely go to one of the walk-in clinics and have them treat that. They can get very nasty if left untreated, if you do have a bad reaction to it. Like I said, the venom is necrotic, which means it rots the tissue. You can get online and look at some of the worst case scenarios. Some of those pictures are very nasty. People that have let it go too long before they've sought treatment, and it can be very nasty. And that goes with any spider bite that's venomous that's in this area.
You mentioned marking the edges, but you want to talk about drawing a circle around it?
You can, if you can draw a circle and just watch for that redness to go outside of that circle, and you can go to the doctor and say, hey, look, 12 hours ago I marked it and it was the size of a quarter. Now it's the size of a silver dollar, and it's grown that much in that amount of time. That lets them know that, yeah, this is something serious, and they can do that and take care of that and give you some antibiotics or whatever they need to do to take care of that.
Gabe, do you or anybody else for that matter know any easy, fun little tips to tell whether a snake is venomous or non-venomous? That may be putting you on the spot. That's why I don't know if anybody else may know some easy ways to see if it's venomous or not.
You know, the easiest way is to try to get to look at the head. If the head is, take your thumb for instance, if the head looks like that, like your thumb, that's non-venomous. If it looks like a spade where it's big, and those are the venom sacs that are in the sides of the head, you're going to see that. But again, I wouldn't tell anybody that if they're bit by any snake not to go to the ER and say, hey, I was bit by a snake. Obviously, if it's a rattlesnake, you're going to see the rattle or hear the rattle. They usually make a pretty good sound if anybody's ever seen one in the wild. I've been lucky enough, I've not done that here in Tennessee. I did see some out west one time at one of the roadside places you stop and see them. But yeah, it's a pretty significant sound when you hear them. But other than that, that's the simplest way, is to try to ID the head. But again, don't get close enough where it can strike you the second time.
Now, what's first aid for a burn? Put ice on it, or?
First and foremost, stop the burning process and then try to cool it. Don't use any old remedies, the old home remedies, the butter and things like that. Just cool it off. If there's any cloth or anything around it, remove that that's been burned through if you burned any of your clothes or anything, get that off. Try to cool the area, run cold water over it, and then look at it. If it's bad enough where it's damaged the skin, then absolutely go to the ER and let them look at it.
Gabe, what about an unknown insect bite? Is ice beneficial?
Some people will tell you that. I would think that it may help because it's going to slow down the spread of the venom through the blood system. It'll shut that off a little bit. But unless you can ID it or it begins to have an issue, then I would still say get to the doctor. And again, you don't have to go to the ER for that. You can go to a walk-in clinic or you can visit the ER, however which one you want to do.
You want to talk about remaining calm whenever a first aid incident happens. You know what I mean? People, the person that's injured really affect the way they, you know what I'm talking about?
Yes. So if you're with somebody and they start having a medical emergency or they get an injury that is substantial, the first thing you can do is try to remain calm. I know for people that's difficult because it's an emergency situation. It may not be something that you're not familiar with, not be something that's in your forte. But the key is to try to recognize that this is an issue. Let's get 911 called. Let's get them some help. And then let's try to help what we can and do with what we can within our power to remedy this situation and try to take care of it the best we can. You may not have to do a lot. You may only be able to hold their hand, or you may be able to, manage their bleeding, manage their airway, or do CPR, or get an AED and take care of them. So just remember that do what you can do within your power. Do what you can within your training, and try to remain calm because they'll feed off you. If you're nervous, they'll get nervous, and then they're nervous, and that'll make you more nervous. So it just feeds off one another as you go through it.
With cuts and scrapes, like if you're in the kitchen, you cut yourself with a knife or something, what is your opinion, and you see this both ways here at Peroxide?
It's a good antiseptic. It's a good cleansing agent. I don't have an issue with it. Now they may tell you something different at the ER, but I don't have an issue with it.
I was like coming in, you may have covered this already, but what if somebody's choking, maybe they've got something lodged in their
Okay.
airway?
All right, so you're at a restaurant and somebody's choking. So if it's an adult, they're going to give you the universal sign. What's the universal sign of choking? They're going to reach up to their neck. You're going to notice they're probably going to stand up from the table, push back, go over to them. You can ask them if they're choking, or you can just walk behind them. And Brian, come here. Well, you're not a good subject. You're going to get to do this to me. So he's going to reach under the arms. He's going to put his thumb right under my breastbone. He's going to put it in his other hand, and he's going to. You're not going to squeeze. You're not going to squeeze. Are we clear?
We're clear.
Okay. And he's going to squeeze really hard, really fast, and he's going to do an inward-upward motion. And he's going to do that until it either comes out or the patient passes out and falls on the floor. Once that patient passes out on the floor, then he's going to activate the 911 system. And with his level of training, he would be able to do some abdominal thrusts and try to get that on out and start CPR. What was that? Yeah, that's true. So you missed a chance for promotion. They could have won up.
But what would you do if the role was reversed, if you had to do that trial? How would you best approach that?
Get on a chair behind him. Sit him back down. Either way.
And it takes a lot more force than what you think, a lot. You got to really, really throw the muscles to it. You can't be
Yes.
afraid to hurt that person.
He's absolutely correct. If you're going to do it, every time you squeeze their stomach, you've got to squeeze it like that's the last time you're ever going to be able to do it. So you want to, the first chance is the best chance because they've got air in their lungs, and every time you squeeze, a little bit of air may get past that, and that lessens the chance that the next one will work. So when you do it the first time is your best time. It's the same way if an infant or a child is choking. When you roll that child over, you're going to take that child, put it in put their chin right in between your fingers and roll them over, and you're going to hit them right square between the back blades, or between their shoulder blades. You're going to hit them on the back, and you want every blow to be the blow that gets that piece out. You want to hit them, yeah, it's going to be a little violent, but you want to get that out. Same way with an adult. It's going to be a little violent, but you want to get that out.
And what do you do
That's
with
the
your
same
thumb
thing
again?
with CPR too. We see citizens doing it a lot of the times, they're afraid they're gonna hurt that person. It's just not forceful enough. When we're doing CPR, it's violent to watch us do that. And quite often we break bones when we're doing that. So it takes a lot more force than what most people realize for both Heimlich and CPR.
It does. With CPR, remember, you're pushing a third of the depth of the chest. So if their chest is 8 to 10 inches through, say it's 9 inches from backbone to sternum, it's 9 inches. You're going to push 3 inches. 3 inches into their chest. And yes, you're probably going to break some ribs. But the alternative is not good. So don't hesitate. It is a little violent when you do it, but especially on CPR, you're pushing a third the depth, you're pushing hard, you're pushing fast, you're pushing 100 times. Any other questions? Or anything I haven't covered that you guys want to ask?
You know, on the Heimlich,
Yes.
you said something about you put the thumb inside,
You're going to put your thumb in your hand like this,
okay,
right there, and then put your palm over top of it,
okay,
in and up as hard as you can.
okay. I thought you said put your thumb in their stomach. Wow, that would hurt.
Oh, it's going to. It'll probably be it'll probably be a little uncomfortable.
What about if a very heavy set person is choking and you physically just can't get your arms around, what's the best alternative?
You can do one of two things. You can sit them down and try to get where you can push against them, or you can lay them in the floor and go ahead and do an abdominal thrust on them.
Like lay them on their back
Mm-hmm.
and just stand over top of them?
Yep. And if whatever you can do, get on top of them, push down. But if you can't physically reach around them, then you're gonna have to make that work some other way. And laying them down would be one way, because if you don't get it out, they're going to end up laying down anyway. They're going to end up on the floor.
I guess several conversations have been about how that you're going to possibly break ribs, and it's going to be uncomfortable, and I think, and then also the fear of being sued or hurting somebody. You know, we may be their last line of defense.
True.
And so with broken bones, is a lot better than laying in a morgue.
Absolutely. Absolutely.
Is someone that uses it protected by the Good Samaritan?
Yes.
Explain that.
Okay, so what the Good Samaritan law is, it states that if you're acting in good faith and with, I don't know the exact specifics of it, but if you're performing in good faith and trying to help this person, you're held harmless if you injure them in pursuit of that. And Monica may know even more about this than I do.
Pretty much. You can react and do the best you can, and if they get injured, they can't turn around and sue you because of this law. So if you can help, don't be afraid of being sued, just see if you can save this person's life.
So,
That's a good reason, because what a prudent person would do, you don't get a knife and start cutting somebody their way, trying to insert a straw, because most people are not competent to do that.
right. Good point.
Do that on your own, that's kind of crossing the line, if you do what a prudent person would ever do.
Just say a Holiday Inn Express.
I'm always looking at you for humor. So yeah, so you are protected if you're attempting CPR or trying to rescue somebody in that situation. Then yes, you are going to be protected. Can they still sue you? Possibly. So.
But the idea is that we're not trained professionals, and so it's protecting us. It's not trained. Now, a doctor has a different, he's on the scene, he has a different set of rules that apply to him.
True.
Now, what if you're alone and you're choking? Is there something about leaning over a chair or something?
Absolutely. Brian?
Throw yourself on a chair. This chair is plenty short for you.
You can lean over the chair and you can place it in the same position that somebody would get behind you for the Heimlich, and you can just lean on it and forcibly push that chair into your stomach and see if that would work. All right, anything else? Anything else you want me to cover? Any questions?
I think you've done a good job.
All right.
I feel like you know a little more than you did when you started. Yeah. You a round of applause.